We all fear pain. It's a common fear that can send us into a state of anxiety, to the point of panic. This unpleasant sensation makes everyone very vulnerable. But pain, it's a defense mechanism that prevents us from danger or illness, and is the most frequent reason for medical consultation. But what happens in our body when we experience pain? A notion signal is sent to the spinal cord, which is responsible for alerting the brain, which in turn sends a message to locate the pain to allow the body to respond. There are two types of pain: somatic one, that we experience when we sting our finger after a day of gym, or when our knee hurts, and visceral pain when our stomach hurts, for example. In short, the International Association for the Study of Pain defined pain as unpleasant sensory and emotional experience associated with an actual or potential tissue injury. However, there is a small group of people for whom it's impossible to describe this experience. What is going on inside their head?
Sweet dreams are made of these. Who am I to disagree? I travel the world and the seven seas. Everybody's looking for something. Some of them want to use you. Some of them want to get used by you.
A patient comes for consultations who mentions that he earns his living at the circus, performing a human pincushion act. Reports feeling no pain when pins, needles, or sharp instruments are introduced into his body. Dearborn first described this disease as pure congenital general analgesia. Today, it's called congenital insensitivity to pain, and it's a condition in which no physical pain is perceived. It is a part of a group of disease called sensory and hereditary neuropathies. It's caused by mutations in several genes, and it's transmitted by autosomal recessive inheritance pattern, except for the mutation in the SCN11H gene, which is autosomal dominant.
In order for us to feel pain, our muscle fibers have a membrane, which by means of an action potential and a neurotransmitter substance called acetylcholine, opens or despolarizes this membrane, causing by many sodium molecules to enter to the muscle fiber throat channel. This is known as action potential. This action potential will travel along the nerve fibers and in turn to the medulla and cerebral cortex, where the sensation of pain will be identified and a signal will return in response to it. There are 6 theories, but only 2 are the most common. The first one to mention is an alteration in the sodium channel, which is caused by a mutation in SCN9A gene. In this alteration, there will be a mutation in this gene, where the muscle membrane will not be able to open this channel to allow the passage of sodium molecules and cause an action potential, so the nerve impulse will not be generated to transmit it to the brain. People with CIP do not have alteration in intelligence. However, they may have a lack of smell called anosmia and progressive bone deformities due to the constant dislocation and/or fractures, known as Charcot joint. The second theory corresponds to the mutation of the NTRKA gene, which is a proto-oncogene that will allow a cell division and proliferation, making an excess of cells. This cell will have a special link with the neurons that transmit pain. This cell also works with the nerve growth factor, so the nerve fiber in charge to send the pain signal in the embryonic stage will not develop. Patients with these nerve fibers won't feel pain, and they also will not be able to regulate body temperature in case it increases Therefore, they will not sweat.
The main symptom of this pathology is the inability to feel pain. People who suffer this differentiate hot or cold. However, the pain that we feel when burning our tongues with a hot cup of tea, they do not feel it. Most of the people with this pathology have many wounds, most of them in fingers and mouth. They also have braces and on some occasion they have broken bones. They will also present dry skin, recurrent Staphylococcus aureus infections, bone fractures, and corneal ulcers.
Currently, there is no diagnostic criteria for congenital insensitivity to pain. However, it requires visible evidence of a lack of nociception in a conscious individual, of normal intellectual abilities. In those with intellectual disability, the diagnosis may be more complicated. Physical examination, the application of 5 to 10 kilograms of pressure on the nails is a reliable test. The assessment of peripheral nerves and the central nervous system is typically found to be normal, like touch, vibration, proprioception, motor functions, and osteotendinous reflexes. In laboratory studies, the skin biopsy is used to determine the density of intraepidermal nerve fibers.
There is no specific treatment for this type of disease. However, several preventive measures should be employed to improve the quality of life of patients without future complications, like hydration of skin and eyes, constant monitoring for body temperature, fractures, infections, washing constantly the hands, checking the foods, mouth lesions should be constant and the routine through all the life of the patients. So a multidisciplinary team should be available both medically, family, and in the area where the patient is going to develop, as well at a school.
Pain is part of our life, and no matter how much we wanted to avoid it, it is fundamental to maintain the homeostasis in our body and keep us alive.